Getting here reporting for 1912 Radio News. So as you can see behind me is that the people of Hillbrow and together with the Department of Health is here have done a protest around Hillbrow at the Hillbrow Community Health Clinic, where they are protesting against Nyaupe. So they are saying for Nyaupe must fall. The people that are using drugs such as Nyaupe, they should stop doing it, and they're spreading awareness in regards to that. So stay tuned so that we can go on this journey and try and understand what it is that they're actually trying to bring awareness to. So as we are reporting today from 1912 Radio, I'm here with Jamila, who is one of the organizers for this protest. So Jamila, how are you doing today?
I'm good, thanks.
Are you able to tell us what it is that you guys are protesting for today?
Well, it's basically against Nyaupe and substance abuse, because the Nyaupe problem does affect our patients because one of the ingredients are ARVs. So basically we're trying to stop substance abuse, and Nyaupe is our focus.
So what exactly is Nyaupe?
It's a combination of dagga, heroin, you can use rat poison, ARVs, detergents. There's a lot of ingredients that can be in it, but the main ones is dagga and the ARVs.
So is your message being heard by the people that are actually doing this drug? Are they going to stop this Nyaupe drug of theirs?
Well, we don't exactly know how many people are on Nyaupe or using it. So basically we're trying to get people aware of it before they get caught up, because it is very addictive and we don't want that problem. So before it spreads very far, we would like to curb it.
So what are some of the challenges you face here at the hospital in regards to people that are using Nyaupe?
Well, basically it's affecting our patients because they're getting mugged outside clinics. They're mixing the medication because they don't want people to know what they're taking, so they don't get mugged. They come back. It will basically affect the government, because they're going to come back and ask for more medication because they've been mugged.
Oh, so they use the medication because they've been mugged, or they ask for medication to take the drugs or to mix the drugs?
It's to mix the drugs basically. So the patients get mugged outside clinics and hospitals for that ingredient because it's one of the ingredients in the Nyaupe.
So they do it deliberately?
Yeah.
Okay, thank you for your time. That was Lerato signing out from 1912 Radio.
Like this.
District pharmacist here in Joburg.
So are you able to tell us what is happening here today?
Okay, as you remember, in the beginning of this month, September, from the 5th to the 11th, we had Pharmacy Week that we celebrated as a country national. So one of the things that we adopted as the district, as the pharmacists within Joburg district, was that together with our Pharmacy Week theme that was given to us by our National Department of Health, we're going to actually incorporate a campaign against substance abuse. So this is basically one of the activities that we committed to do, and that is an awareness campaign around substance abuse, as well as discouraging the use of Nyaupe within and around our community.
You mentioned the fact that it's substance abuse, but today I see the theme is Nyaupe. Why did you guys choose to only go for Nyaupe today?
Okay, what we saw as pharmacists, we thought most of the drugs that are being abused are actually out there and they're given focus. But when it comes to Nyaupe, it seems as if it's something that happens only in our black communities, if I may put it that way. And not much work is actually done around that particular drug. So we felt that because now we see it every day where we come from, we thought maybe we need to just probably zoom into that, because we know it's there, but nothing much is happening, formally around that drug.
So how does the Nyaupe drug affect the hospitals, the pharmacies around Joburg or around the country?
We see a lot of young people that would come, with symptoms of withdrawal when it comes to Nyaupe. And what we've actually realized is that most of our health professionals are not trained to deal with people that come in with such symptoms. So I think it's high time that we actually also embark on the training of our health facilities, our nurses in particular, in terms of how to identify and help those young people that actually come to our facilities.
So how has the response been around today's protest?
No, a lot of people have actually been supportive of this. When you talk to most of our patients, you actually have a number of them that can relate, to the issues and what actually Naupe does to a family unit. So there's been a lot of support for this, and we hope that it will not only end here, but more can be done to actually, end this scourge in our communities.
Thank you very much. So that was the Ratum Kupi, and we signed out. We just spoke to Ostembi and she just told us about the journey that happened today. So don't forget, we are trying, as the Department of Health is doing, we are trying to stop Nyaupe and all substance abuse. Thank you. Today here right now we're with Mr. John Klamini, who is from Sanka. Are you able to explain to us what it is that it is that you're playing here today?
Well, as Sanka Central Rand, we are an alcohol and drug center, and we support any initiative that is related to substance abuse. The pharmacy have taken initiative to create awareness about Nyaupe, which is also our case, and not only Nyaupe, but our prescription drugs, our over-the-counter drugs. So we are here to support. I mean, we're doing the same thing, all of us here.
How bad is this drug scourge around Johannesburg?
Well, there's a child as young as 8 who is in a rehab as we speak today. We have a 14-year-old who has last been in school 7 years ago. So the substance abuse, it's that big. It's not only what we see, it is in our homes. So our parents should help us keep the children in schools, keep them occupied, so that the substance abuse does not grow. The problem now is that the age group of substance abuse users is dropping.
I see today you guys focused on Nyaupe, and you also mentioned like the over-the-counter drugs that the people are using. How bad is that?
Well, in schools, the children today, they take cough mixtures, mix it with cool drink it in classes, or take benzene and put it in crepes packets, snuff it in class, which is very difficult for teachers to see, because anything that you do that seems okay, you will not suspect it. So the level of drug use, the people are becoming creative, the people are using different methods in terms of using the substances.
How would you encourage all those young people that see this over, like you're saying, just putting it in cool drink, benzene, how would you encourage them to actually go out and stop or spread awareness when it comes to all this drug abuse and substance abuse?
Firstly, I would ask the parents to be responsible for their children. You cannot spend an hour not knowing where your child is. That is number one, that's supervision. And for the children, we as organizations need to have programs in schools, out of school, after schools programs to keep these people occupied, spending their time effectively while learning.
So as a member of a representative of Sanka, what are you guys going to do moving forward to help curb this problem?
Well, as Sanka, we are in almost all the schools in the Gauteng region. As Sanka Central Rand, we are implementing the Kimoja program with youth at youth centers, at schools. We do talks at churches on a daily basis. On every week, we are in our communities on a daily basis trying to create awareness about the substance abuse.
And how has the response been throughout the churches, throughout the schools, and throughout the communities?
Well, the only problem is the people we want to attend the events are probably the ones that will not attend, which is the ones we need to reach out to more. But the people that are, the concerned parents that are willing to take initiatives, they do come. We can only win this if we have the partnership of the communities, especially our parents, to look after our children.
Thank you very much. I hope that all goes well throughout. Thank you very much. Thank you.